And I see the hi in the chat. Hey, Sydney, thanks for joining us tonight. So once we move beyond our dietary strategies, another valuable thing is to look at lifestyle strategies. So things like consistent exercise can be huge. It shows to improve brain function, it shows to normalize immune function, but it's key that we do this within tolerance. So if you are going out and exercising and feeling completely wiped and exhausted afterwards, or it's taking you many days to recover from that exercise, that is overdoing it. And there is, again, good research that shows that that sort of overtraining syndrome is not beneficial to people healing and getting better. What I recommend with that is, if you'd like to continue to incorporate exercise, reduce the time of it or reduce the intensity of it. Or for some people who, even with that shortened duration, just make sure you're walking. And that can be something that can be well utilized by people at many different stages in their health, and can be still used for positive benefits. Now, in rare cases, but this does occur, some people will need to avoid exercise completely for a period of time. And I know that sounds a little crazy, and obviously I'm recommending that we should do it here, but if we're having so much of a negative response, then it is worth our while to help to support our system overall first, before we then get back into exercise. So as long as we're addressing the underlying cause, then we can go back and add that in later. I mentioned here, obviously, we need to focus on exercise, not just because we want to burn calories, but because it has so many other positive benefits for our health. 3 to 4 times a week is a great place to start, especially if we have a little bit of a background in exercise, and 15 to 30 minutes. So it doesn't have to be something where you're at the gym for 2 hours killing yourself. In addition to exercise, consistent sleep. Now, that's sometimes easier said than done, but we can do things like making sure we're getting to sleep at the same time every night, waking at the same time every morning, and avoiding a lot of the blue light that we get from our phones, TVs, and computer screens within the last hour or so before bed. Now, additionally, as people work on their gut, work on their thyroid, that can help to normalize our sleep schedule and reduce things like insomnia. And so sometimes, just like the exercise, these things have to be addressed in tandem to each other. Lastly, and I cannot drill this into you guys enough, but stress modulation. Sometimes we can be doing everything right, the perfect diet, the best supplements, making sure we're exercising. But if you have stress that's not being addressed in your life, that can throw everything out of whack. And sometimes those are the most difficult patients for me to work with, where we can have issues when they run into more stressful times, because that stress response is inflammatory and it changes the way our immune system works. So the best that you can do to either reduce your stress during the work week, or reduce your stress at home, or find different things, whether it be meeting up with friends on a consistent basis, or journaling, or meditation, or reading a relaxing book. Whatever you need to do to manage your stress, you need to take the time out of your day and spend some time on you. And that will be just hugely impactful for supporting your thyroid and supporting your immune system. Lastly, we already talked about some different supplementation for our gut, but there's also some supplements that can be very beneficial in terms of supporting our immune system. So remember, with Hashimoto's, it's not so much about the thyroid gland. Yes, that's the thing that's being picked on here. That's the thing that's causing our symptoms, but it's due to these other external factors like our immune system, which are leading to that destruction. So things like vitamin D, if you haven't had those levels checked, it may be valuable for you to do so, because there's good research showing that improving vitamin D levels can help to reduce autoimmunity and Hashimoto's specifically. Sometimes people will be taking around 1,000 to 2,000 IUs per day, and that can be an okay maintenance dose for some people. However, vitamin D levels can get so low that you need to utilize a higher level for a period of time to get you back into that normal range. But it's important that you're checking on these things and following up with reevaluation labs to make sure that those things are responding and the vitamin D isn't getting too high. Curcumin, which is the active ingredient in turmeric, is an anti-inflammatory compound which is known to reduce different inflammatory cytokines associated with our immune system. And so as we work to support our overall immune system function, curcumin can help to reduce those inflammatory markers, which can contribute to a lot of people's chronic pain, fatigue, etc. Omega-3 fatty acids are very critical because oftentimes in the Western diet, we have an elevation of omega-6 fatty acids, which are pro-inflammatory. We need some, but we don't need too much. And we have a deficit of omega-3 or anti-inflammatory fatty acids. So in regards to Hashimoto's, omega-3s are very, very supportive of immune system tolerance, and that's why it can be such a valuable asset for us to plug in and support the way our immune system is working. Additionally, some things like iron and selenium can be critical depending on the person. Now, iron has been shown in people with non-responsive hypothyroidism symptoms to actually be the single defining factor that restores things like fatigue, brain fog, etc. But we need to make sure that we're checking serum iron, ferritin, which is our stored iron, and our iron binding capacity to get a whole picture on these things to determine whether iron supplementation is applicable or not. Now, I would like to note that oftentimes the ranges for ferritin, especially for women who are a little bit more prone to iron loss due to menstrual cycle and with Hashimoto's not doing a good job of absorbing this, those ranges will range for ferritin from about 15 to 200. And 15, while it is the low end of that particular range, is not well accepted by any sort of research article or even the World Health Organization, which puts the bottom end of that at 50, saying that iron remediation or getting ferritin stores above 50 can be very positive for improving overall symptomatology with our thyroid. And there's even some articles that are coming out and saying that maybe 70, 80, or 100 is what is required to see improvement in the way our thyroid works. And the reason why it's so crucial is because that TPO enzyme that we talked about, it's an iron or a heme containing enzyme. And so if we lack iron in our system, let alone the impacts that it has on our neurotransmitters and detox in our liver and our ability to transport oxygen, well, it also has a direct impact on the way the enzymes in our thyroid work. Now, selenium is a little interesting because many people will be able to get this from our diet, but there is a certain amount of research that suggests using 200 micrograms of selenium can be positive in the reduction of TPO and possibly TG antibodies for people with Hashimoto's. And this is warranted within a trial of about 3 to 6, and in some studies, 12 months. That being said, excess selenium can be a problem and can increase hypothyroid symptoms, hair loss, and change energy output. So that goes back to our old adage that anything can be both positive and negative, and we need to know the consequences of each of those. Now, whether you're doing a dietary intervention or gut support or specifically immune support with a lot of these markers here, observe changes. These are only a piece of the larger puzzle. Now, some of the bigger ones, which is why I included it for you, but we want to assess, is this positive for us or do we need to look to different areas? And at the bottom, I have that reminder that we can react to any supplement or therapy at any time. So make sure you're working with your doctor in terms of applying these things. This looks a little bit blurry on my end, but what we have here is another research article that just shows there's multiple nutritional factors that are associated with the risk of Hashimoto's. So as we think back to what I said about the changes in TSH and T4 and how some people will just disregard those antibodies, and we already know that those antibody elevations can have implications for our brain health all by themselves. Well, additionally, there's other things at play here that affect our thyroid gland beyond just making sure we have enough thyroid hormone, whether that's in the medication form or through your own body's production. And what I have highlighted there is something that I just mentioned, which is Hashimoto's patients are typically iron deficient, since autoimmune gastritis, which impairs iron absorption, is a common comorbidity. And it's really important in the conclusion here that clinicians should check patients' iron, especially in menstruating women, and vitamin D status, correcting any deficiencies as necessary. Additionally, selenium intake is valuable, especially when we have low selenium intake from our diet, and that may be warranted as an intervention as well. So it's not one thing, it's many things all at once, and that's what's so important to take away as we sort of work through these complex health conditions. Expected outcomes when it comes to Hashimoto's. If we are supporting the right things, you can expect improvement or changes within 30 days. So if you decide to implement a whole foods diet and you're not seeing any sort of changes within that time, then it's an appropriate break or time for you to say, okay, let's change things, let's do something different. These things should not take months and months and months to see any sort of changes. We may not see total improvement, but we should see positive improvement. Now, autoimmune conditions cannot be cured, even if antibody levels normalize. Now, that's something that's positive for the way our thyroid works, that's positive for our physiology, but there is still the possibility, due to the memory in our immune system, that these things can flare up and cause damage to our gland once again. However, even with those things existing, the better job that we can do with minimizing the antibody attacks or the antibody interaction with our thyroid, we can still have lifelong success, minimal symptoms, and be able to live the lives we want to be able to live with proper management of these stressors. In overview, hypothyroidism is defined by a decrease in total T4 or free T4 or both, and an associated increase in TSH. But again, hypothyroidism is just an umbrella term. It's a descriptor that represents those changes in lab markers. Hashimoto's hypothyroidism is the above markers, the T4 and the TSH, with either positive TPO antibodies or antithyroglobulin antibodies, or both. So it is a reason for why someone would have hypothyroidism. To properly address hypothyroidism in these situations, then you need to address the immune system dysfunction, and that comes with identifying different triggers, supporting proper immune tolerance, etc. Chronic thyroid changes and immune dysfunction will often lead to associated inflammation or an increase in inflammatory cytokines, and that may require rehab in multiple systems. So we just mentioned the changes in absorption of iron in our gut, and therefore to see complete resolution of someone's symptom like fatigue, they may need both support in their immune system and some iron support for a period of time. Autoimmunity does not go away, but improvement is possible. And sometimes these things can be a little bit of a double-edged sword where, yes, no one wants to have autoimmunity, but when we become aware of these things, it allows us to be proactive in our health, do the things that are necessary to optimize it, and be able to have great function for the rest of your life. And that's our webinar for tonight, guys. So thank you so much, as always, for joining me. I hope you learned a lot. I packed a bunch in here, and again, my apologies if it was too much. Sometimes I have a tendency to do that. But if you enjoyed the webinar and are interested in learning more about you and how your thyroid works, we do offer free consultations to anyone who attended the webinar. And we additionally set aside some specific time to be able to get you in because these spots fill up relatively quickly and we do have a bit of a wait time. Now, we covered things like immune system dysfunction and gut dysfunction, but at our consultation, what we're able to do is review you and identify different aspects of what could be going on with your health that could be contributing to your Hashimoto's, figure out what your goals are, and decide if we are a good fit to work together. Now, if we are, I will let you know, and if we are not, I will let you know too. There's no pressure in these things. It's just some time to be able to have a conversation, and as I have on the slide, determine if we can be part of your team. Now, normally these consultations are $147, but they're free for those of you who are attending this webinar. And all you have to do is get in contact with the office either by phone or email, and we'll be able to verify that you attended the webinar, and this ends Friday at 6 p.m. So just make sure you contact us before that time. So here again is the slide that I shared with you at the beginning, all our different social medias and ways to get in contact with us and stay up to date on all this information. This webinar was one that we had done previously, but it's been updated with a bunch of new research, and I'm trying to always make sure that I stay current for you guys. Our next webinar will be again Tuesday, April 2nd, 7 p.m., and it is going to be talking about or the title of the webinar is Eat to Support Your Thyroid. So some of the things that we talked about tonight in regards to dietary strategies, we're really going to delve into those, talk about the different details, and discuss the things that I use all the time clinically for my patients here in the office. So that's all I have for you guys tonight. Again, thank you so much for hanging out with me. I really appreciate it. If you like our content, as I said, make sure you give us a share, give us a like. I really appreciate it. It just helps us get in touch with more people. And I will make sure to post the consultation sign up over in the chat box there. And you're welcome, Danette. Thank you for hanging out with us. If you guys are interested in the consultation, you can follow the link there, or as I said, follow up with the office either by phone or email. So that's all I have for you guys tonight. I'll hang out for just a little bit. That way you can ask any questions if you have any. I'll make sure that I check the submission box here at the top. But otherwise, you guys have a great night. Get in touch if you need us, and hopefully the sun sticks around for us a little bit longer and everyone can get some time to enjoy that. So take care, guys. Thank you so much.